Hello, I'm Dr. J. Matthew Knight, MD, here at Knight Dermatology Institute in downtown Orlando, Florida. There are many ways to treat skin cancer when it occurs, but one of the most common ways is an often misunderstood procedure called Mohs Micrographic Surgery. It's named after a very well-known skin surgeon named Dr. Fred Mohs, who developed this one-of-a-kind technique for embedding and processing tumors in the skin. It's been refined over and over and over again over the last 4 or 5 decades. And now doctors use it as the #1 tool for the treatment of basal and squamous cell carcinoma in the right setting. Mohs is a simple procedure at the bedside, but it's a complicated procedure behind the scenes. First, the patient comes in and an area is numbed up just like normal. A small disc of tissue is removed, and that disc of tissue is taken to the pathology lab, where it is stained, marked, frozen, and then cut on a large machine called a cryostat. Once that tissue is cut wafer thin, it's applied to a glass slide and presented back to the dermatologist who took your original layer to look at it under the microscope. And we look at it like a pie, if you can imagine a pie crust. So the dermatologist will look at all the edges of the pie and all the base of the pie, ensuring that the cancer has been completely removed. If the cancer hasn't been completely removed and there's a small area, either deep of the pie crust or at the edge, then you'll go back to the room one more time, be renumbed, and a little bit more will be taken. This is continued on until the cancer is completely eradicated. Mohs is not indicated for all skin cancers, far from it. There's only some skin cancers that meet appropriate criteria for Mohs. But if your doctor tells you that you're a candidate for Mohs surgery, then it's a really wonderful way of treating skin cancer, achieving as high a cure as possible while sparing as much native tissue as possible, meaning the smallest possible scar.